Welcome back, genius. I'm GDY, who want to tell you how to turn on subtitle. 한글 자막이 포함되어 있습니다. 한글 자막 키는 방법 모르시면은 여기 위에 버튼 누르시고 참고하시기 바랍니다. Does your client have shoulder pain, also neck pain, and do they have movement disorder on their shoulder and neck? The muscle we will study today has severe effects on your scapular and cervical spine alignment and dysfunctional pain. Today's main character is the Levator scapular muscle. First, let's draw. Take a picture of your neck and shoulder posteriorly. Draw the scapular and first to the first cervical spine on the picture. The Levator scapular starts from the superior angle of the scapula and superior medial part of the scapular medial border. Also, it attaches to the first, second, third, fourth transverse process of the cervical bone. The name of the Levator scapula tells us an essential function of that muscle. Like its name, it can make your shoulder to elevation. First, let's look at the Levator scapula from the posterior and think about it. The Levator scapula goes up to the cervical spine from the scapula. When the cervical vertebra is fixed, if the Levator scapula shortened and concentric contracted, or the scapula goes up or down. I'm sorry, this was a really easy question. Of course, it goes up. It never goes down. If your client's shoulder height is elevated than neutral alignment, his Levator scapula will shorter than normal length. On the contrary, if your client's shoulder height is depressed than neutral alignment, his Levator scapula will longer than normal length. We stretch it when it has shortened rather than normal length. We have made it shorten when it has stretched. In other words, if your client's shoulder lever is elevated than neutral alignment, he should relax for his shortened Levator scapula. If your client's shoulder lever is depressed than neutral alignment, he should exercise for his lengthened Levator scapula to recover its normal length. Alright, we got it. When the Levator scapula concentric contracts, your scapula can be elevation. Besides, does it make your scapula move to inward? The Levator scapula goes to the slightly inwards. When the cervical vertebra is fixed, the scapular superior angle will move to the inward. It can never cause the scapular superior angle move to the outward. Most of my patients with higher shoulder than neutral alignment also had a scapular superior angle close to the spine. Let's change the rule. The Levator scapula also give effect to the cervical alignment and movement when the scapula is fixed. If the scapula is fixed, the Levator scapula is shortening and concentric contraction, then your cervical vertebra 1, 2, 3, 4 will move toward the scapula. If your left Levator scapula shortened and concentric contracted, your upper cervical spine will tilt to the left. So the head tilt to the left, it may or may not be. So the head can tilt to the left or it can tilt to the right. It is determined by other muscles attached to the cervical spine. For example, think this. While your left Levator scapula pulling the upper cervical spine to the left, the right scaling muscles attached to the middle lower cervical vertebra is pulling your middle lower cervical vertebra to the right. So which side will the head tilt? It tilts towards the stronger pulling side. So when your upper cervical spine is tilted to the left, to control the balance of your eyes and vestibular organs, the middle lower cervical spine is often tilted to the right. Have you ever seen a person walking around with a severe and slanted eyes and ears? Most of all, a person will try to maintain a balance, the eyes, and the head, including ears. Even they give a balance of the thoracic and lumbar spine or shoulder, pelvis, hip, knee, ankle, or other areas. Because the control center of the human body is here, the brain that inside your head. It's a sort of compensatory joint chain reaction to maintain equilibrium. Just in time, I met a student who had this cervical spine imbalance pattern on my class last Sunday. I did her posture evaluation. Her head located to the right, not to the center of her body. That makes sense? Why is her head has this imbalanced posture? Please turn around. Her upper body mobility side is left, So her middle lower cervical spine is convex to the left. Her middle lower cervical spine is convex to the left means that she has the right tilted head posture. Her head tilts to the right. However, is there anyone like her who is severely tilting their head to the right? That's horrible. To straighten her head, she tilts the upper cervical spine to the opposite side, like this. So her head was moved to the right side, that's right? That makes sense? She has a cervical shortened region where the upper part is here and the middle lower part is here. I treated imbalance in her cervical spine after the explanation. This is the message she sent me.
Mr. President, I learned so much in 4 weeks, but I am sad that I cannot put it all in my head. I massaged my suboccipital area almost every day with Jennings and Mortal. My neck pain didn't disappear because I didn't do it properly. I was so surprised that after the demonstration model, I had a severe migraine on my left for 2 days that day. After you treated me, my headache disappeared, and I felt very comfortable. I realized that I had to be accurate.
It went deep. Let's study this more next time. Anyway, when the levator scapular muscle shortens or concentric contraction, it can tilt the upper cervical spine to the same side. This time, this is the side of the levator scapula. The superior angle of the scapula is located behind the transverse process of the upper cervical spine. Your upper cervical spine will rotate towards the rear as your levator scapular concentric contract. This means that if the left levator scapula is shortened or concentric contracted, the upper cervical spine are rotated to the left. Notably, the first cervical, the atlas, has the largest transverse process compared to the other vertebra. Also, atlas is responsible for about 50% of the head rotation. Simply put, when the head is rotated 90 degrees to the left, the first cervical vertebra rotates about 55 degrees, and the rest of the cervical vertebra shares the other 55 degrees of movement. As such, the first cervical spine plays a significant role in the rotation of the head. The direction in which your head rotates is the direction in which your first cervical spine rotates. If your client's head posture has rotated to the left, his left levator scapula will be shorter than normal length. The other side will be longer. I will summarize today's study. Body types in which the levator scapular muscle will be shorter than normal length. First, a body type in which the scapular lever is elevated rather than the neutral alignment. Second, a body type in which the upper cervical is tilted and rotated the same side rather than the neutral alignment. Next, body types in which the levator scapular muscle will be longer than the normal length. A body type in which the scapular lever is depressed rather than neutral alignment. Second, a body type in which the upper cervical spine is tilted and rotated the other side rather than neutral alignment. Don't just sit there and watch. Think. Action. You can do it. First, you take a picture of your neck and shoulder area. Second, draw the levator scapular muscle. So you think about my levator scapular length is normal or abnormal. You can't tear it up. The levator scapular muscle. You want to see more pictures? Check in my Instagram. I hope today's video will help you to be a genius of body type. See you soon, guys! Oh my god, I left one out. The levator scapular can never rotate the scapula to downward.